Yeah, we are the same age.
I know you're safe.
Ladies and gentlemen,
Eyes on Miss Briggs.
This is the only other person.
this is one I wish I had a little more teacher skills. Happy New Year, everybody. Welcome to the Wyndham Region School District Board of Directors meeting. Today is Wednesday, January 5th, 2022. The time is 6:30. We are in Wyndham Town Council chambers. May I have a roll call, please?
Sure. Kate Bricks,
Here.
Jessica Bridges,
Here.
Jenny Butler,
Here.
Marge Gavoni,
Here.
Pete Hensler,
Here.
Char Jewell,
Here.
Kate Levier,
Here.
Scott McLean,
Here.
Mike McClellan,
Here.
Al Potter. Here.
Excellent. Will you please rise? Join me in the pledge. I pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Any adjustments to the agenda?
I would like to, at this time, make a motion that we move board roundtable, so it is after the superintendent's report, which would be then item 7. Second?
Thank you. All those in favor?
Oh, we need to do a,
Oh, that's right.
because Pete is remote, we need to do a
Has to be voice vote.
Roll call.
Kate Bricks,
Yes.
Jenny Butler,
Yes.
Pete Hensler,
Yes.
Marge Gavoni,
Yes.
Scott McLean,
Yes.
Jessica Bridges,
Yes.
Mike McClellan,
Yes.
Kate Levier,
Yes.
Char Jewell.
Yes. Perfect. I'm probably going to forget that, so I apologize in advance. I'm so used to raising my hand. Public input. Now's an opportunity for the public to comment on items not on the agenda. Just a few reminders, most of which you know. We're permitting 3 minutes per person to speak. We're changing it up a little bit. Instead of signing in, we are asking if you have any questions, if you'd submit those by email. That would be very helpful to us. And just a reminder that there can be no discussion of any kind regarding school personnel. I think that about covers it. So I entertain who would like to come up first to speak. Seeing none?
Yes.
Excellent, excellent.
Do I sit? This is the first I'm doing. Do I sit right here? Oh, perfect.
Podium, Steve.
I don't know. I'm nervous. I'm sorry. So my name's Steve Adams. I'm a teacher at Wyndham High School, and I actually was a student in Wyndham Schools, and I was a community member before I became a teacher here. And I wanted to start off and just by saying I'm really thankful and grateful I get to work in this district, and that I've appreciated the leadership that we've had over this pandemic, and I like that we've been thoughtful and diligent and trying to be factful in how we've been doing this. And I want to just start by saying that I recognize that everybody is feeling a level of stress and a level of hopelessness and all of the stress of what's going on in the world right now, and that we're trying our best. And I wanted to just say that, just to say, like, my next comments, I'm not trying to say anything negative about any district leadership or any admin, because I understand that they are just as stressed out, and I feel like we're lucky to have Ryan, Phil, and Vanessa at the high school at least. So I just wanted to speak tonight because I feel a compelling urge to speak for the stress that teachers are experiencing right now. I've had lots of teachers come to me after break, and I just collected some quotes that I would like to read to you. So I feel like there's a very difference in the perception versus reality of what our teachers are living through and experiencing right now. And whenever we try to express that, we feel heard, but we don't feel like anything changes. The amount of time being consumed with meetings about things not related to trying to make it through this year and get kids reacclimated is excessive, and it feels more about holding us accountable than improving teaching and learning post-pandemic. Sorry. Turning on the TV or going online, and I just feel so demoralized and demonized for what I'm trying to do with my kids right now based on things that actually are not happening in our school. It feels like we have a lack of time to do our basic job responsibilities. I'm in survival mode, and I continue to cut out high-level, rigorous learning activities because I do not have the time to properly plan them, and I do not have the time to properly provide feedback on them. I will not be able to provide a midterm this year because just of the way the schedule is. I will not have time to create one or build one, grade one. Covering classes due to lack of subs has begun to impact my family life, and as we have to bring more of our work home, I feel like I can't complete it or keep up, and I feel like I'm doing a terrible job. And then the one I've heard the most often is, I am so sick from job-related stress, and I continue to have to take days off for things like therapy or trying to talk to my doctor about needing medication to manage my anxiety and depression. So those were just some quotes that I collected from teachers, and I know that's a lot, and I'm not trying to, again, speak ill of anybody, but we need to put the teachers' oxygen masks on before they can help anybody else right now. And thank you for your time.
Anyone else?
I just want to emphasize what this gentleman just said. I think the teachers are going through a heck of a lot. And I was actually wondering, as I heard a teacher at our last meeting who was very passionate about what she does, and she was stressed from trying to help the kids. And I really feel that some of us that come up here are getting the wrong idea of what we're trying to do. There's some things that we don't feel medically are backed up by science, that masks and those things are not necessary, and they're hurting our kids more than helping them. And it might even be hurting the teachers more. And honestly, I think the teachers should get a bonus. I don't know if that's been considered at all. Maybe they should start at $5,000, $2,500 for last year and $2,500 for this year. And if you've got how much money did you guys get? I'm not sure, but maybe the teachers could know that, because any person that works as hard as they are in the real world would get the bonus. And I think they deserve it. So we're here to help the teachers and help our kids. That's the main initiative of everybody in this room. And if we disagree on some things, that's what it is. But I guess the frustration from myself and others is when we come to this board repeatedly and ask the same questions, and you tell us you're going to email us, and you don't do it. And maybe that's some of the teachers' frustrations. You're the school board. You got to unite us. And you don't even answer our questions. It's repugnant. It's absolutely repugnant. And the definition of that word is a conflict, and it's incompatible. The example given in a sentence is a bylaw, which I think you guys have, cannot be repugnant to the general law of the country, which means that I don't think that bell should override my freedom of speech. The Liberty Bell may be cracked, but it is bigger than that one. And for you guys not to pay attention to us, it's hurting everybody. So don't think it's us. We want the best for our kids, and that's why we're up here. So I've asked this question a bunch of times about the transgender questionnaire that went out, okay? This is what you think of it. You don't care, okay? You just don't. Let's be honest. You haven't answered it. I asked you to find the word prevent because you put up that the vaccine prevents the disease. It doesn't. So that's something you're telling the kids, and you're making them use the word incorrectly, and you don't correct them. Okay, so that's another thing. You're lying about it. The other thing, okay, the mask, it's a double standard. You guys are telling our kids to wear the mask from 7:30 to 3:30. You guys aren't doing it. I don't do it, but I admit it to my kid. I don't tell them to do it. If I had the right to tell them to do it, I tell them not to do it. My kids have had COVID, they get over it. It's proven scientifically not to have an effect. It's like 0.1 or some minute thing. They're more likely to get monocryolysis, Rob, you can help me with the term, from the vaccine than they are to be permanently ill from this disease. The masks are doing more harm to their cognitive development. The science is everywhere on this. And I don't know why you folks can't buy into it.
Thank you, sir.
Ding fries are done. You cut me off. Yeah.
Appreciate it.
Liberty Bell's bigger. That's all I can say.
Anybody else?
Don't forget the teachers.
Carrie Grant, resident of Wyndham. Just a quick question. I know CRT has been on the back burner a little bit. I'd just like to know the difference between CRT and equity. So if somebody could send me an email and give me a definition of both or just how they're different, that would be great. And also, I'm asking for the resignation of Jenny Butler. Thank you.
Before we have any further comments, I just want to clarify that if you have a question, if you please email us. Thank you. Anybody else?
Email your questions, which I did.
Anyone else?
Hi. Thank you for having us. My name is Dr. Robin Frost from Wyndham.
Folks, I can't hear her speak. Thank you.
And I mimic the sentiments that was said with the teacher. I also am very proud of the teachers, and from my students' perspective, understands that it's not just them that are suffering, although they are younger and more vulnerable and developing. It also are the teachers and any of the school staff that is participating in this environment that's requiring all these restrictions and such. So I too thank you for and reiterate the fact that that kind of stress that you feel, I know you know that your students are feeling that every single day. For whatever reason it may be, we do know that kids, they don't like wearing masks. I'm sure you don't. So I didn't email this question, so I guess I'm not able to ask it, but just in follow-up, you don't really have to respond to me. I'm just looking for some documentation, Mr. Howell. With all the grant information, I noticed that you did send out a link to notify people of the grant coming down the line. You also sent out a questionnaire, and I wasn't quite sure where that questionnaire, I didn't see that questionnaire. But if you can just shed some light real quick on that. Okay. Oh, I'm sorry. You know what I will do? I will email you that. I don't want to waste anybody's time here. There's a questionnaire. The follow-up question to that is, I didn't see anywhere where it was made known to the community or the parents that that these grants did have specific assurances and requirements, and I didn't see where the parents were notified that where the requirements were listed. Okay, and very clearly in the grant information application, one of the requirements is universal masking, as you know. So I think that if you could just show me where you sent this out to the community and the public would be really great, and I appreciate that. Also, I didn't email this either, so you don't have to answer, and you want me to email it, just tell me to email it. But I'm just wondering about the HIPAA privacy laws, how it pertains to schools. And I know it's different with something called FERP, something like that.
Thank you.
Okay? So just interested in that. Thank you so much. Everybody have a great night. Appreciate it.
Anyone else?
Hi, my name is Ken Anderson. I'm a citizen of Wyndham. And I just have a concern about the strategic planning process that I was looking through, that you guys have out. And I'm looking at the core belief statement, and I'm trying to understand and square in my mind where exactly the core is coming from. I'm not sure where you're getting the belief part of it. Like, is it like what's its source? What's its ontology? What's its genesis? What is it you're citing here as core? Because it lines up with a couple different religions in a lot of respects, so I'm not sure exactly what that means. So I would appreciate that explanation, please. And the other one is a concern I have that says on page 2, the first bullet point, it says, we need to attend to the whole child. And then it says going beyond academic needs. I didn't think we did that here in public school. I understand that students from time to time have concerns and they get upset about certain things. But it's confusing to a lot of parents to see that and wonder what your doctrine is. Like, what is it you're trying to influence these children into? Like, better thinking based on what? I understand the other term is intrinsic motivation, but that doesn't really have an explanation either. How is it we're intrinsically motivated? By what? Is it our parents? Is it a book? Is it Eastern religion? Christianity? How do we know this stuff? Because the country was settled on Judeo-Christian beliefs. And we've seen a lot of a lot of anti-American stuff going on. So if we could all get an explanation as to the substance that you're trying to teach our children, because a lot of it lines up with Marxism and communism. And because we're all intelligent, we understand those terms. We get our intelligence from an intelligent being apart from ourselves. I think we need to recognize that. That's an absolute truth. It's not a subjective truth. So we need to understand from the school board how it is you're getting this core. Because it's like the nucleus. Where is it derived from? We don't know. It's just not explained. And we'd appreciate an explanation. Thank you.
Mr. Anderson?
Yes.
Thank you. Would you please email us your specific
I
questions?
will.
That would be helpful.
Yes, thank you
Thank
for
you
your
very
time.
much.
I appreciate you all.
Who's next?
Anybody else? Hi, everybody. Thank you for your time. I'm Stephen Napolitano. Just a couple of, follow-ups. I'm just looking for an update of the civil rights team, and I believe that they were supposed to be, had a conversation about what's age appropriate about things and what's not. I know that there was a poster up in Manchester that the sign was removed on the bathrooms that it said all welcome, which I don't think that was the intention. So that's good that that happened, that the signs are still up in the school. I just have concerns about really pushing an agenda on 9-year-olds talking about their sexual orientation with anybody other than their parents. So also another follow-up is regarding the vaccine data sheet that went out that clearly stated that taking the vaccine will prevent coronavirus. We all know, unless you know, with all due respect, living in a cave or just not really trying and paying attention, people are getting COVID that are vaccinated. We don't want anybody to get sick. We all want the same thing, and we're hoping it all works. But when we are promoting vaccine clinics on campus, the schools should have a liability policy, and I want to find out where we are in that situation. Okay, we all want to be protected. We want to protect our school. I'm going to ask this question: would each board member, and keep in mind, I am all about choice, having people have the choice, and I know the school's not mandating that, but there are benefits for people, extra perks if you're vaccinated versus not, which I do believe is unfair. So would each board member be willing to sign a personal statement of responsibility if any student suffers from future side effects or even dies from taking the vaccination on school grounds? We really have to think about that stuff because we don't want our school to get sued. We don't want any kid to have issues with it. And you have to understand, there are side effects. This is happening. Does the school board believe the vaccine prevents COVID? Because, I mean, that was sent out. All right, so, and lastly, we have a school board member that violated the Code of Ethics guidelines multiple times. Currently, there's no policy in place to remove a board member unless they commit a crime against the board, okay? That was removed in 2009, from what I understand. I'd like to know why, and then I'm asking the board to reconsider and put that process back in place to protect the integrity of our board. So when we have a board member that's writing and promoting CRT, which I'm told we don't teach that in school, why is that why did that happen? Then say, get ready for opposition because these right-wing extremist parents are coming. Okay, that's, okay. Jenny, I asked Jenny, you really need to resign. Thank you.
Just to be clear, I'm going to reiterate this. I'm going to reiterate this just because it's a new process, that since we're not having you sign in with your email address, if you would personally follow up with an email to us, that would be very helpful. Anybody else? Okay, seeing none, we will now move into the superintendent's report.
Sure, so I'm going to, first of all, I think go off a little off script here and say, Stephen, thank you for coming tonight and sharing those concerns of staff members. And I know we had a chance to meet with other people on Zoom. I don't even know when that was because days are blending. But I really appreciate you coming forward tonight and stepping up. I do remember when you were a student at Wyndham High School. It does seem like it's not that long ago, but I really appreciate you stepping up and talking about that tonight, so thank you for coming out. I have a couple things prepared tonight, and then before have a chance to jump into presentation. So first of all, I did send out at 5 o'clock this afternoon something that I don't like doing, and I don't think any of us like doing, that Wyndham High School is going to need to go remote for tomorrow for classes. We do not take these decisions lightly, but given where we were with staffing and being able to make sure that we could safely staff all of our classes and make sure everything is taken care of, we're not going to be able to have a full in-person day for Wyndham High School tomorrow. So that message did go out, and did have the opportunity to talk to Mr. Karen quite a bit this afternoon and just take a look. We will reevaluate tomorrow to see where we're at. Mr. Karen is a master at scheduling and pulling things together and working to support, and we'll see where we're at that moment. But it truly is a sign of where we are right now in the pandemic. Coming back, and I think probably everybody saw my letter that I sent out to the community. We had 122 cases over that 2-week period that from December 22nd to January 4th. Just to put that in perspective, I mean, think about last year. We had 159 cases all last year in our school year, and to have 122 in that 2-week period just shows kind of where we are at the time. And just, I think it's important for the public to know that what we saw in our district is being seen by every other district around us. There were some text messages going with all the superintendents yesterday and just saying, where are you at with your numbers? Where are things at? And I think everyone is seeing what we're seeing with cases. And for those districts that are doing pool testing, their initial pools were coming back with high numbers. So for this next couple weeks here, I think we're going through another little spike. I think for the next couple weeks here, we're going to do the best that we can to keep things staffed and to support people. But I think we're going to need to ride this for the short time period until we get the next lull. And I think that we're all looking forward to that possibility of that happening. So with that being said, with case reporting, and I wanted to talk to the board about this before sending something out to the public. I have sent out so many COVID community connections over the past 2 years. And yesterday I chose, because to do 122 lines of cases and when they happened and who they happened just was not going to be a possible thing. And so really just wanted to let the board know and just get it out there to start moving towards more summary letters for the data, for the daily pieces. Because especially right now, cases are moving very, very quick. When I spoke to Ryan this afternoon, he had 5 cases at 3 o'clock. And so things just building and numbers building. We know it's important to get that information out. I think what's most important is for teachers and for parents and for staff members and for kids to know when there's a possible contact in a classroom. We will continue to do that and make the notifications that we can, but for some of those longer, wider district ones, I think a summary one might be the best way to go, and so to do that the best that we can. I think that we've come to the understanding right now that COVID's around us. It's here. I think part of this is now we're learning to live and what this looks like. And so it's going to be important that we make sure that we continue to provide that information. Tonight I'm going to talk about a new change to the SOP, which came out last week. We also anticipate additional changes that should be happening within the next 2 to 3 weeks of things that continue to go forward. So we want to keep the public informed, and we want to do it in a very reasonable way. Now, something else I wanted to share with the board is I know many of you have been following the vaccine mandate that the federal government has been putting onto workplaces and districts, and especially any employer with over 100 employees. There had been a temporary stay in the courts with that. That has now seems to be moving forward. And at this point, I think OSHA's meeting in the state of Maine on, it's either January 16th or January 18th, Board of Occupational Health will be making the final rules and continuing to move forward. What that's going to mean for RSU 14, because yes, we definitely employ more than 100 employees, is that by the middle of February, we'll need to have either a mandatory vaccination or mandatory weekly testing for those that are unvaccinated. At this point, unless there's a change in the OSHA rule, we don't really have any choice. The fines that we've been told are between $13,600 and $136,000 for each and every violation of this OSHA rule, which is a school district. That is some serious funds that we don't want to put in. So it looks like our date to get that going would be by February 9th. Back in November, I did a pool testing application for the district so that individuals that we need to go ahead and test, that we would then have the opportunity to make those as easy as possible to make sure that we're testing our pools. But to know that that's coming, as soon as that information is definitive, we will let all of our staff know what our plan is going to be moving forward, and to make sure that they're kind of in step with what the next steps are going to be. So some things moving forward with that. Also, if I can just take a minute.
Please.
Just a couple questions that came up tonight, just to make sure that, Robin just left, and I'm sorry I didn't catch her on that. I think she was referring to an ESSER 3 questionnaire that was posted on our website, and there was an accompanying letter that went along with that. Robin, if you watch this come back, if you would just go ahead and email that to me, I can send you the link to the letter that went out. Also, Ms. Frostburton-A did a presentation back in, I don't know if that was October or November, on public comment period for that ESSER 3 application, to make sure that we get that. The other thing I just wanted to mention with something that Robin talked about tonight, the ESSER 3 application did require you to discuss as a district where you were with universal masking. The verbiage that was included in there, to the extent at which the district has adopted a policy related to universal masking. A district could have answered, the extent of ours is that we have not adopted a policy on universal masking, they still would have received funds. A district could write that to the extent that we've adopted a policy, yes, we have adopted a policy, and they still would have received funds. And I know reading through those federal assurances and some of those documents can get it along with some of the speak in there. But again, I hope she gets a chance to email me, and we'll make sure that she gets that answer. Just a couple things, the strategic planning process, those core beliefs, someone please send me that. Core beliefs actually came from the community, from a public forum that was held on March 5th, 2019, because it was the last public meeting we held prior to COVID. And it was an evening meeting where those core beliefs were developed and were done by the community. But again, if he wants to reach out and connect on that. And then some of the other pieces, I know people are going to email me, but I know those are quick and easy answers that I could maybe give. And I'm done with that with my report, and I'll jump into SOP after Board Roundtable.
Okay. Who would like to speak for Board Roundtable? Sure.
First quick question, you mentioned pool testing. I'm assuming that you were referencing pool testing for employees, not students.
Correct.
Just want to clarify, that's no big deal.
Yep.
Sorry. So I asked about the pool testing and making sure that was applicable to employees and not students, to make sure that nobody thought otherwise. I also wanted to comment on our new agenda format. It's something that we decided to change up last night. The reason, and correct me if I'm wrong, please, the reason that we're asking for emails, for questions to be emailed is that so we don't miss anything to respond to. So it's not that we're trying to be obtuse or difficult. It's we want to make sure that we have all of the information and we don't miss something and don't answer your question. So that's why we're asking for email questions. Two quick things. Last meeting, I had asked about the learning loss and whether or not that's being measured, and I was wondering if you knew when that data might be available for the last couple of years for review.
I'm trying to remember now what the report that Christine, Annual Achievement Report. Wow. I knew it was in there somewhere.
Right.
Annual Achievement Report has been posted to the website.
Okay.
We'll be doing winter testing coming up within the next couple of weeks, and then we'll have spring iReady testing as well as spring NWEA. I think we'll know an awful lot at the end of the school year. But that district achievement report, for anybody who wants to take a look at it, it's posted on the website.
Okay, thank you. Also, I just wanted to reiterate my support of the board hosting an open workshop to have open conversation with concerned parents and citizens of Wyndham-Raymond. I think that's a good idea. And then speaking specifically as an individual, not necessarily as a board member, I appreciate you coming in and talking about teacher stress. It's something that I think gets lost sometimes in discussion. But I also want to partner that with not only child stress, but family stress for the last almost 2 years. I think that each of us experience the stress as, we cope with it as individuals, some better than others. But I do think that, in my personal opinion, that we need to start to recognize the reason that we're in this situation is because we let other people make decisions for us. And those decisions, it's turning out, may or may not have been a good idea. And I don't mean specifically the board. I'm talking about our government elected officials and those that are appointed by those officials. Also, the middle school survey keeps coming up at every meeting and via emails. I'm speaking for myself. I, as a board member, feel that it was extremely inappropriate, and we have taken steps, I believe, to make sure that something like that does not happen again. So I just want to make sure that those that are concerned with that survey and the content thereof understand that I did not agree with it. I was shocked by it, and will endeavor to make sure that doesn't happen again. Chris, you mentioned the explosion, for lack of a better word, in positive cases. I think that there's a couple things, in my opinion, that are feeding that. One is that the current variants are more contagious than prior. I also think that it's probably indicative of people outside of school not following the best protocols, or I shouldn't say best, but recommended protocols, possibly. And people are just getting tired. They're getting tired of social distancing and school being canceled and being quarantined and having to wear a face covering. And, Dr. Fauci just came out the other day and said that cloth masks do no good against Omicron. Basically, that's what he said. And people should be wearing either surgical masks like you folks or N95s or KN95s. So, if Dr. Fauci's saying it, it must be true. So, but one final question as an individual, and obviously I'm not expecting you to comment on it now. What happens if we choose as an RSU to totally disregard the government protocols related to COVID? And that is all I have.
You want to answer right now?
Sure.
you open yourself up to some tremendous legal liability. It's actually against the law through Maine statute to not follow, and I can't remember if it's Rule 258 for Maine statute. I can send that to you, Shar,
That'd be great.
what that is. Lewiston tried that and did find themselves in a bunch of trouble with Maine government, Maine CDC, Maine DOE. They also found that no athletic teams would actually play them because they disregarded protocols and nobody would go to Lewiston to compete. So all those kids, there were actually a couple articles in the Press Herald about homecoming being canceled because teams wouldn't come and play. But you're required by law as a district.
Okay. So I appreciate that. And I think it's important for us to communicate that level of information to folks who think that it's just our decision as a board to follow these things when there's a big reason why we are doing what we're doing as a board. And I wasn't on the board when the masks were voted in. I spoke against it at the public meetings. But there's serious trouble for the RSU if we go against the government. Now, speaking as an individual, it is up to us as citizens to vote in people that make reasonable policymaking. And that is the end of my comments for this evening.
Go ahead, Mike.
It's always hard to follow Char. Our lists are often kind of the same. So what your last comment was kind of my first comment, and I agree with you in terms of the conundrum that there are things we can't affect. There are things that we have to do. I was reading, my wife's an educator, I was reading with her this weekend some information from the DOE on some of the newest changes, and some of it was contradictory in itself. 5 days for this, and everybody's in 5 days, but no staff are in 10. It didn't make sense. But it's kind of what we have to deal with. But I work with the legislature, and this is an election year, folks, and a lot of energy from some folks is going into this body. There's a body above us that you can also be talking to. And having been one, I can tell you politicians in an election year sometimes soften and have better listening skills. So it might be a hint that there are other people you can be talking to about this that might actually be able to affect things more than we can. Secondly, I just want to say, I love that parents show up. When I came on just before Char in, I think, August, and I was told, yeah, parents don't come to the meetings and it's really quiet. And so this might feel awkward, and our body language probably suggests that, but I hope you guys keep coming, and even when these issues resolve, come to talk about math or things like that. I think it's the way this is all supposed to work. You mentioned the gender survey, and I just agree with that. I agree with that. We've brought that up a few times, and I don't feel like we've had any resolution to that. But one thing I'll say, having listened, and I think Kate has had the burden of answering a lot of emails, and it's a hard job. And again, there's laws and things that she has to follow. She has to be careful in some respects as to how she phrases things. I think that, what was I going to say? I think that as I've read her emails, I've read your emails, CRT is happening, and things are very broad. If you could come in and say on this date, this happened, that's a much more of an actionable thing than to say CRT is happening. I've been on the board for 6 months or whatever now, and I've been around a little bit. I haven't seen anything. And actually for my work, I'm actually speaking this weekend in another school district on CRT. So I kind of know about it. I know what's going on nationally. And when I've talked to the administration here, and as much as I can, I've had my eyes open. I don't have the concerns I have, like when I look at Virginia and some of those places. It doesn't mean it's not happening. I don't think it is, but but if there were specific things, then we can start having conversations. But when people come in and just say, well, CRT is happening, I don't know what to do with that. So that's just me again. And the final thing I'll say is we talked about the code of ethics, and we've learned that it basically has no teeth. So some of us have suggested we get rid of it, because why have a policy that you're not gonna, that doesn't mean anything. So I think we'll, as a board, continue to have a discussion about that, and hopefully something will come out of that that'll be productive. So I have a really long list, but I'll stop there.
You had mentioned something, Chris, about the COVID vaccine. And I know that the Supreme Court is going to be hearing that case on Friday, whether or not that moves forward. But my concern is that the first speaker that stood up and talked about the lack of substitute teachers, if that vaccine mandate goes through, that's not going to help our teachers. That's not going to help anything. So I am curious, do school districts that are meeting with OSHA officials have the ability to lobby for our teachers, our substitutes, the people that are feeling the stress, as they had called it, the kitchen staff?
I'll just quickly respond. We've not been invited to the table on that. We have the chance to meet with our individuals in Augusta, but what we've been told is that Maine's an OSHA state, and the OSHA rule is what's going to actually govern the state of Maine. So, yes, we can go ahead and share our individual thoughts, but as far as RSU 14 making a difference in that decision, not aware of an avenue that we've been given to do that.
When is that meeting taking place?
It is either the 16th or the 18th.
And who is conducting? Is it DHHS?
No, it's Bureau of Health and Safety, or Safety and Health. It's Bosch. I thought, but Bureau must be Safety and Health.
Okay, thank you.
What was that?
I am.
Okay. Anybody else? Jen?
This Saturday, in case you didn't know, at 7 o'clock, there is a virtual concert raising money for the Richard Nickerson Scholarship Fund. It was started in 1997 by a group of parents of Wyndham Chamber Singers. There's not a cost officially. It is a virtual concert, but donations are graciously accepted because it is a scholarship fundraiser. Those who perform are all Wyndham graduates, and the earliest one is from 1988, which was Rick's first year at Wyndham High School, so that's really cool. And you can find it on the Richard Nickerson Scholarship Fund Facebook page, and there's a link to be able to make a donation there too. Number two, there have been some questions and comments about whether I would resign my position representing Wyndham on the RSU 14 school board. To be clear, I will not resign.
Thank you. Anybody else?
After being at school for the last couple of days, I would personally like to see more information about daily screening to come out, because I've seen a lot of kids at school who are sick, and they're coughing, they're sneezing, and a lot of them, they said, oh, I got tested, I don't have COVID, but they're still at school and they don't feel well and they're sick, and that's just not you really shouldn't be at school when you're not feeling well. And I think a lot of these kids think that they don't have a choice, they have too much work to do, and they just have to be at school even though they don't feel well. And I really would like to see more information put out about people coming to school when they don't feel well, and that it's okay to stay home because you don't feel well.
Thank you.
I want to thank all the parents and staff for coming. As Mike said, we're usually a pretty slow group here. We really don't have much of an audience. We're not sure who watches at home. We only hope people are watching and listening to what we say. I do want to say that we do listen to what staff and what parents have to say and what their concerns are. And we understand that everybody should advocate for their students and everybody should advocate for their own children. But there's one thing I just want to remind people of. We are responsible for over 3,000 students and 700 employees. And even though we do listen, this is nothing personal. When we say we don't do what you think we should do, and we're doing what we think is better for all, there's nothing personal in it. We're doing the best we can with what we think is correct, what's the right thing to do. Our major thing this year was, how do we get the kids back in school? And we felt, okay, we took the course that we felt would get them all back in school. It has worked out well for some, it has not worked out well for some others, and I guess the best I could do is apologize for that. But it is not, it's not the fault of the administrators, it's not the fault of the board. And we just keep trying, and we will keep trying.
Thank you.
Oh, Pete, that's right. He can actually hear you off of that.
Any comment, Pete?
Yep.
I don't actually have anything.
Thank you, sir. Thank you all for your comments. Thank you to the public. We try to be extremely responsive, and so we're hoping that this new protocol, instead of you leaving, and oftentimes people in the moment forget to leave emails, and so we're kind of scrambling with that too. So this way we can have your emails and really scrutinize and not have to figure out what the questions were. So I appreciate you all following up with that. I have nothing else to say, and so I think we'll move on to item number 7, standard operating procedure for contact tracing for Maine schools.
So I know it's a riveting topic for everyone, but it's an important topic for RSU 14. It's an important topic for our district. And I think it's also important for the public to just kind of understand the process and things that we go through. So I think all of you were surprised. I know that I was on Monday of vacation week for National CDC to come out with new guidelines, new quarantine guidelines that were for us out of the blue. And much like OSHA doesn't come talk to me, Scott, National CDC, as much as I'd love to have a conversation, didn't reach out. And so, I know. And so to have that opportunity to say, oh, by the way, we had known that Maine Department of Education and Maine CDC were working on a new contact tracing protocol already. That was something in the works. And that was due to come out, I think, the very beginning of break. Actually, I think they were looking at the Friday before the holiday. But with CDC guidance coming out, they decided, you know what, we're going to need to change things up, and there was a little bit of a delay. And so midway through vacation, I think it was December 30, I sent a notice out to the community on December 31st with just some of the highlights and some of the changes. And I thought it would be important for everyone to hear just kind of what some of those new pieces are. The other thing I'll add is we've been told that this is one of 2 changes to the contact tracing protocol that we can expect. And all we've been told for the next one is that it will be coming in single-digit weeks. So that can be anywhere from 1 to 9 that we will see this next iteration or next version of the contact tracing protocol. So just some pieces and some goals that were shared throughout the updated SOP. We've contact traced 500 cases in the past 2 years. And so we've done that under several different SOPs. And it seems like every time we have a different SOP, and Mike, you brought it up, we find there's some inconsistencies within it. And even, I think, on the board, I'd sent to you on December 29th a version of the SOP, and on December 30th, there was a brand new version. And there were even some changes made overnight, and we may even see some changes that are made as things are caught up on. But one of the things that I know we heard a lot of complaints from parents, and I get it, I truly get it, and it was hard for us to explain, which was universal masking covers you in a classroom. Why doesn't universal masking cover a student on the bus? And in the old SOP, Universal masking allowed you to go with 3 feet to a student, allowed you to provide an exemption. You couldn't provide that same exemption when a kid got on a bus. Same thing happened with if you exempted a student for universal masking in the classroom, they couldn't go to chess club after school, to an after-school activity. It made it very, very difficult to explain, and I totally understand why people were frustrated with that. In fact, I think I remember early on in the process doing a Channel 8 interview out in front of the superintendent's office, and even at that time, people were unsure there was even a mask exemption and some of the things that you could do with that. So a lot of this particular update is to make sure that clarity. So for instance, with universal masking, we can now apply a universal masking exemption to everywhere that a student's wearing a mask. So if it's in a classroom, if it's an activity, if it's on a court, if it's on a bus, we can provide that exemption, which was it's nice to be able to have that clarity. It's a whole lot easier to have a conversation too with somebody to say, what does my kid get by wearing a mask? Well, we can at least provide these exemption. Other piece that it did was mirrored some of the updated federal CDC guidance, and I know there's been all sorts of discussion, listening to the radio, coming into work this morning, and even I was up at Jordan Small this afternoon and just hearing some comments about the change now from the 10-day quarantine period to the 5-day quarantine period. What does this mean? How come they went about and made that change? What's the impact of that going to be? A big part of this is reduce the number of students needing to quarantine. And this is huge. And I've had the opportunity now, I've been added to a working group, small working group, looking at additional changes. And I've had a chance now to meet a couple times with Dr. Shaw, which has been just kind of an interesting thing with a small group. And my comment to him yesterday is that the SOP that we were previously had, we were quarantining students when the impact of why we're having to quarantine was actually, Shar, what you talked about, was coming from the community. Schools are safe places. We're not seeing a lot of transmission in schools, but yet we're putting kids back into the community where they're actually better if they're in school. And so looking at how do we reduce the number of students needing to quarantine, because honestly, the safest spot for kids to be right now is in school. It really is, to the extent that we can, because we know protocols are being followed and that we have that ability to make sure that kids are getting what they need. The other thing that was listening to one of the comments today, which was just talking about schools that have been remote for months and months and months on end, and the harm that that's causing to kids just because the amount of time that they're out of the classroom, not with their friends, and not having that opportunity to have that daily interaction. And then also to provide some clarity to quarantine, and I actually think it was Dr. Frost who was the first one to ask this, which was, what is actually going to be the definition? Is it going to be boosted is now the new definition of vaccination? Is it just accepting the 2 doses is what's going to be? So I had a chance to provide that clarity. And Shar, this slide I threw in here actually goes to your question, which is public health policies such as quarantine length are determined by local health authorities and are based on the latest available science, U.S. Centers for Disease Control and Prevention. Your local public health authority makes the final decision about how long quarantine should last based on local conditions and need. In Maine, the local health authority is Maine CDC. And I think it is Chapter 258. I'll send it out to the board. I'm back on my desk. I actually have it on my desktop. Specifically says that CDC has the authority to enforce and to set this up. So, Mike, you're absolutely right. There are other policymakers that are looking at this. If you want to affect change, that is a great way to affect change. We give feedback. I give feedback every opportunity that I can to the people who are those decision makers. But again, it's important that they have that feedback. But ultimately, CDC determines, Maine CDC determines quarantine length, what it looks like. Districts, the only power that a district has is they actually can make quarantines longer if they want, or they can move more students out of school. We have taken the stance as a district that, to the extent possible, we're following those guidelines to make sure that we're keeping kids in school. So here's that quarantine length. So December 27th, it was a Monday. We all thought we were going to have maybe a quiet couple of days for vacation. National CDC throws that out. And I was in a meeting with the commissioner on the afternoon of the 28th, talking about what might this look like and how might it be impacting state of Maine. So people with COVID-19 should isolate for 5 days if they're asymptomatic or symptoms are resolving. And I think that's important. And Al, I'm glad you brought that up, and we'll send out in our next update, we'll go ahead and put in that daily screener again as a good reminder. But part of the change from 10 days to 5 days is that people should be asymptomatic. And if they have had COVID, that they're improving. So things like they don't have a fever. But making sure that we're going to try to reduce that risk to others. The other piece that goes along with some of the CDC guidance, which is that all of this is reliant on people coming back wearing masks, is where they're at. So it's 5 days in, wearing a mask when others. And so 5 days your infection period, if you're asymptomatic or you're improving in your symptoms, and then additional of 5 days of masking. We're a universally masked school, and so coming back and wearing a mask isn't an issue. And this is the interesting part that I think all of us have been paying attention to in some of the commentaries have been made. This idea that, especially with Omicron, that onset of illness, 1 to 2 days prior to the onset of symptoms and 2 to 3 days after seem to be where people are most virulent shedding the virus. And so that was part of the change. Again, this was a surprise to everybody. No idea that this was coming. But it was something that Maine CDC reacted to and included it in the most recent SOP. So let's go back to universal mask exemption, because I think this is where everybody's thinking, how do we keep kids in school? What do the masks do? They do play a role here, and they do play as a district, because we're not a pool testing district. We are a masking district. And there are a lot of masking pool testing districts that are out there. So universal masking, classroom exposures, exempts you from that. Bus exposures, I will tell you most of the quarantines, I'd say 90% of the quarantines that took place in RSU 14 from August to December were either on the bus or lunch. That's really where they were taking place. And so to be able to then remove that bus exposure piece, school activities was another one where out on the court, there was a piece where close contacts on an athletic field, which is no longer a thing, but close contacts on courts or in other events, soccer games, field hockey games, football games. Contact tracing a football game was one that was an interesting thing. How do you even, I mean, that is close contact. But now universal masking exemption for indoor sports is included within that. And one caveat with universal masking exemption, can continue to participate in school activities. That was one of the hardest conversations I think I had with a parent, which was the SOP says this. Yes, this is what the SOP does, but you know what? It doesn't make sense. And so now I think we've got some sensibility where that universal masking now goes across all. Vaccination status. And again, this was one of the changes that we saw within the guidance that I think I sent the board on the 29th and then between the 30th. So number one, recognizing vaccination status for exemption as boosted. I have 2 students in the UMaine system. They got emails yesterday to say, guess what? You need to be boosted or you're weekly testing. Which was a bit of a surprise. We were kind of wondering what was going to happen with that. The second bullet was added because initially this vaccine exemption was not going to include, but students who are fully vaccinated, 16 and 17-year-olds, according to they're eligible, but they've not yet received that, can still be exempted for that. Fully vaccinated, not eligible for a booster, and vaccinated again within the past 6 months. So in that last one, completed the second dose of Pfizer, Moderna within the past 6 months, or J&J within the last 2 months. That you can be considered to be vaccinated. We've not seen yet how this is going to apply, Scott, to that OSHA rule, what the definition of vaccination is going to be. I think like any rule like that, it's all in the details as far as where districts need to be and what's going to happen. And then outdoor close contacts. what CDC shared with us and what our state nursing consultant shared with us is that not a lot of evidence for transmission happening outdoors. So outdoors, even with direct physical contact, we not require quarantine. So as we head into the spring sports season, so athletic activities, recess, or other outdoor school activities, that there's not a need to do that. And we just wanted to share this as one of my close to last slides. This is what we take a look at, and this is what the nurses look at and the administrators look at if we think we have a close contact. Close contact still has that definition of within, it's actually 3 feet masked for greater than 15 minutes or within 6 feet. There's different rules with that now, so I'm going to go within 3 feet masked because we're universally masked. Within 3 feet, and so here's where we take a look at. So if a student is boosted, they don't have to quarantine the community or school. Fully vaccinated, they don't have to do that. Eligible for a booster, and no quarantine. Their second dose, no requirement to quarantine. If you are participating in a school pool testing, requires a community quarantine. If you're an unvaccinated individual in a school pool testing, you need to do a community quarantine for 5 days and wear your mask around others. You'll go to a total of 10 days. Mandatory masking policy is the exact same thing. One comment that I've heard from some schools across the state so far is that if you're in a pool testing situation, why pool test? Because it doesn't get you out of community quarantine, because universal masking will do the exact same thing. And then if there's no masking whatsoever, it's quarantining 5 days and wearing a mask around others for 10. So here's the table I sent out yesterday. I think what's something that's amazing, there's been a lot of these happened over vacation. I would say roughly 90 of the cases were from vacation. The other 30 were from the first 2 days of school that we became aware of. And one quarantine out of all of that. So moving forward to take a look at what happens this week. I don't have final numbers for cases that have come in today. I know a number of the buildings are working on cases and still trying to make those connections. We'll get that community update out to everyone. So that's where we are with the SOP. Again, this SOP could be in place for the next 2 weeks, 3 weeks, 9 weeks, and it could quickly change. But for the moment, our nurses have had great opportunity. They've met several times. We've had a chance to talk through with the administrators and just to make sure that we all fully understand and that we're applying this. The official date for start of this was cases starting after just trying to think here. I think it was January 3rd. We did some early application over vacation with kids coming back, just to make sure that they were coming back to school within the time. So I don't know if this board has any questions. Go ahead, Kate.
Is there still the 90-day exemption if a child or student, because I shouldn't have said child, they're not all children, has had COVID? I didn't see that anywhere on the exemption.
Yeah, and that's actually one of the changes I think we're expecting because the 90-day exemption didn't go away. But they did not include it in this version, in this table, and so we've given that feedback that still exists.
Hang on just a second. To be clear, we didn't create this table.
This came right straight from Maine CDC.
Okay, thank you. Wait, I think Shar B.
So, and I'm sure this is probably written somewhere, but I'll ask the question. So if a parent calls the school and says, you know, my child woke up with a cough this morning, so I'm not going to send them to school, which to Al's point is what they should do, right? Let's say the child is out for a couple of days, and then on day 3 or whatever, the parent sends them to school because their symptoms are gone. I'm assuming there's no requirement to test in that scenario, right?
No, but I would want to check with the nurses to see what they're providing for information, because I am not a nurse.
Right. No, and so, but it's not in the SOP that they are required to test. I'm assuming.
There is, and happy to send it to the board, there's also a SOP that's given to school nurses for, and it's the level of the different symptoms that are there, and whether they're, and I can't remember, just maybe you know what the categories are within them, but there are low-risk symptoms, I think there's high-risk symptoms.
Okay.
So based upon that,
Right,
they're
so-
providing feedback.
Right, and that makes sense that the health professionals in the schools could make determination, like if a kid was going to show up with meningitis or something, right? That makes sense. But if a child is out for a day, it's determined that there's no reason to escalate it, then there's no contact tracing, there's no any of that other stuff. Everybody just goes about their lives as normal. So I just wanted to clarify that. Thank you.
Yeah, and actually, Shar, you brought up one thing which I forgot to put in my presentation. Prior to this latest update, we were discouraged, or the nurses. The nurses were discouraged from taking home test results. There is such a shortage of testing right now that they're able to then take those testing results. What they don't do for you necessarily, though, is some of the home tests would not give you the 90-day exemption based on the quality of the test. But with now the number of exemptions that can be granted, that's a possibility. So prior to that, we did have nurses meeting kids in parking lots, swabbing them in cars, doing tests, and given the volume, it's not something that we can even do. So it was given a choice as whether or not we would do home tests, and we decided absolutely we would take a home test and the results from that.
So is that, sorry, because I just to follow up. Is that new that you're adding that in? Because I know that wasn't the case for a while.
That's new within the SOP.
Okay, thank you.
And I forgot to add it as one of my bullet points.
Just in time.
Thank you. You had mentioned something 1 through 9 weeks or something like that, where there's going to be a new SOP. I didn't understand that. Can you elaborate on that?
Sure. So this SOP, which is what we're working under now, we've been told another one's coming. And all that we've been told for the next version is that it would be single-digit weeks as far as when we're going to see it.
What does that mean?
So it means less than 10 weeks.
Less than 10 weeks.
Yeah.
Right.
Okay.
Yeah.
They're really
Oh.
covering themselves.
Pete has his hand raised.
Go ahead, Pete.
Yeah, thank you. Just a comment, I guess, is that as we continue to evaluate and reevaluate, I would want us to really think hard about considering home test results. There's been a lot in the news recently that the home tests are not sensitive to the Omicron variant, and I can speak firsthand from experience that there's a lot of false negatives that these home tests are producing. We had 3 negative home tests, only to go get a PCR test and find that that was definitely a confirmed. So, and I made that observation like a week before it came out in the news, but now it's out in the news, is that for Omicron specifically, which seems to be the new dominant variant, these home tests are not effective. So that would be the only concern or caution I would say in regards to that.
Anything else? Okay. I'm looking up there and I don't see him, but I heard you. Did you have a? I did. Okay.
Thank you. Just out of curiosity, all the new COVID cases that you were recording over the last few days, what criteria are the nurses asking for, and what are you recording on the spreadsheets? You know, are these, do they have fevers over 102? Clammy, chills? Are the nurses asking for that information, or are they just saying, are you not feeling well?
I'd need to circle back to the nurses and I don't even want to venture a guess with that.
Okay, fair enough. If you wouldn't mind just getting back to me on that, because I am kind of curious as to whether or not that information is being captured. I feel like if I came down with a cold tomorrow with a runny nose and a cough, I could take a PCR test and test positive. So it seems like this thing is going around really fast. It doesn't seem like masks are really kind of helping. It doesn't seem like any type of vaccine is absolutely helping. And I just want to say for anybody that is listening that you had made the comment, and I know from my experience in doing some fact-finding that the CDC is the one that puts out these SOPs. The CDC reports to Department of Health and Human Services folks. Commissioner Lambrou is in charge of Department of Health and Human Services. She is appointed by Governor Mills. So I'm really glad that you, Shar, had asked the question as far as what happens to businesses that don't comply with these guidelines, because there are fines that are being handed down and will be handed down. The fight with this stuff is on the state level. It's absolutely on the state level. And we need to take this fight to the state level and let's try and do our best not to villainize the teachers that are working in the schools, the administrators that are trying to enforce these rules. We need to do everything that we possibly can to take this fight to the state level. And that is my high horse.
Thank you.
Thanks.
Before I get to Jessica, just a clarifying question, follow up to him. Would the SOP from the school nurses that you said you were going to provide us, would that give him the information that he's
I think
seeking?
that it does.
Okay.
I've not seen an updated one, and I'm not even sure if it has been updated. But I'd be happy to send that out to the board. And it's provided through, I think it's Maine Health Partners and through the state. And basically, it's an SOP for the nurses with symptoms, all the different things that they need to follow and check up on. So
Okay.
I will send that out.
That would be fantastic.
Can I ask Scott a clarifying question really quickly?
Yes, you may.
Thank you. Sorry, Jessica. When you were saying that, were you meaning if a student is positive, what are the nurses asking their symptoms are? Or are you only saying, like, if my kid is out sick tomorrow, are the nurses then asking?
It's not just students, but it's also teachers. I mean, my wife is a teacher at a neighboring district, and she is working very closely with kiddos that are testing positive, and they're completely overlooking the teacher level and just quarantining the students. And it seems like there's a complete and total double standard with maybe that neighboring district, but it's everybody.
So is it just if a student is positive, you want to know what they're asking?
I'm assuming.
And I'm not going to be the one who answered
I'm
you.
assuming that those numbers are only tested positive cases, correct?
Okay, gotcha.
Okay.
Gotcha.
That's what I'm curious
Okay,
about.
thank you.
So my daughter
just
was
wasn't
out today because of a headache. I wouldn't expect her on that list. But,
No, those are confirmed positive.
right. So I'm curious as to what the follow-up questions are.
Yep.
I was just trying to figure out what
I
you were
appreciate the
exactly
question.
asking.
Finally, Jessica.
You're good. It's not that important, really. I just wanted to say I agree with Pete, working in urgent care and the medical field. I do these tests every single day. I see the symptoms. You don't have to have a fever. The symptoms are all over the place. And we have seen a lot of false negatives. And I can't say it's Omicron because we don't actually type it, but we send out a lot of PCRs that come back positive. So, just a cold. And as far as the nurses, when my kid is out, I ask her and say, hey, they have these symptoms, what do you think? Of course, I'm lucky I can just go to work and get them a test, but, yeah.
Thank you. Any other questions for Mr. Howell? Thank you. I think this was a good conversation and clarifying some questions, and I appreciate that. We're going to move on to item number 8, vote to authorize treasurer to transfer amounts among cost centers. May I have a motion, please?
I move, I'm sorry, I lost my spot for a second.
That's all right.
I move that the vote entitled Vote to Authorize Treasurer to Transfer Amounts Among Cost Centers be approved in the form presented to this meeting, and that the secretary file an attested copy of said vote with the minutes of the meeting.
Second. Thank you. Any public comment? Mr. Howell, before we get into board discussion, if you would just clarify
Sure.
what this means?
This is a new motion for the board, and it's a housekeeping motion, and it's a motion that's being required by our new auditors. It was not a process that was required by our old ones. And what it does is that you as a school board, you have your overall budget, and then you have your 11 cost centers. You are allowed as a board to be able to transfer up to 5% from any of those cost centers to other cost centers. And typically you as a board have approved at the end of the year additional expenditures in Bill's area to cover things. And a great example this year is that we did the track early. In last year's money, it was in this year's budget, and we did it to free up some money for construction costs and architect costs that we knew that were coming. So we overexpended that. We had money in other places in the budget to cover it. The other spot was the all other category, and the auditors this year, the $600,000 transfer that the board did to capital reserve. Typically, the other auditors would just allow one of the lines to be overexpended. What they did is they overexpended that capital reserve, and then we had to do a journal entry to move money from other cost centers. And so what you are approving as a board is the authority for me to go back with Stacy, balance the books. It does not affect the bottom line of the audit that was given to you. In essence, it's just saying that all their expenditures and Bill's line for facilities, that we can go ahead and we can balance those things out. This upcoming year, now knowing that this is going to be a requirement from our auditors, I will most likely be asking the board to take a vote on this in your last meeting in June, so that as we complete the audit, we can just go ahead and balance those books out ahead of time prior. The previous auditor, which I think had been here for 20 plus years, allowed us to approach that differently.
Thank you. Any board discussion about this? Nope. Okay. All in favor?
Kate Bricks,
Ha-ha. It's not just me. Yes.
Jenny Butler,
Yes.
Pete Hensler,
Aye.
Marge Gavoni,
Yes.
Scott McLean,
Yay.
Jessica Bridges,
Yes.
Mike McClellan,
Yes.
Kate Levier,
Yes.
Chart Jewell.
Yes.
Thank you. Moving on to item 9. I don't know why that didn't look like 9, but it is 9. Policies. May I have a motion, please?
I move to approve the first reading of Policy FE, Construction Site Protocol.
Second.
Thank you. Any public comment? Board discussion. This is a new policy. In a lot of ways, it's very exciting that we have this before you. It's a result of our building project for the new middle school, combined Raymond and Wyndham. And I believe our attorney, Bill Stockmeyer, was the one who crafted this because it's well beyond our pay grade. And so, policy committee met and didn't put their fingers on it. So, any other comment from the board? Yep.
Question. Can you define clerk of the works?
Clerk of the Works and owner's representative. So a clerk of the works would be somebody who would be on site, would be working with the contractors, kind of helping the general contractor oversee the project. Someone who's an owner's representative is actually doing a little bit more quality control, In addition, is making sure that all the requisitions are done correctly, the quality of work's done correctly. Mr. Hanson will be coming before you as we get closer to the process of determine whether we hire a clerk of the works or an owner's representative. Bill has some great insight into that, and will be sharing that with all of you. It's an important position. Wyndham High School, when it was done, had a clerk of the works. It did not have an owner's representative. And Bill's thought is that as we head into a project of this magnitude, that it might be better to have an owner's representative on site all the time.
Okay, so if you have somebody that wants to visit the active construction site, they would need to contact the clerk of, that's a tough one. Clerk of the works. Okay.
Arrange for the visitation, yes.
Great. And that site visit would be overseen entirely by the clerk of the works. Okay, I just wanted to make sure that I was reading it correctly, because it's a little lawyer speak in here.
Yeah, we didn't touch this one.
Yeah.
Yeah.
Marge, thank you.
Yeah, just a follow-on to that. Is that covered under the state? Are they going to pay for those two individuals if we get two?
For us, it's going to be an either or.
Oh, okay.
And most likely, as a district, that is a cost that we're going to need to cover.
Okay. Okay. I didn't know if they did or not.
No, in essence, it's somebody who's on site who has your interests in mind as things go through. And obviously, we're quite pleased with our architectural firm and the quality of the work that's been done. It's always good to have another set of eyes that are on the project all the time, making sure that things are done correctly.
Cool. Thank you.
I'm just wondering, as far as liability, when we're having a construction site and it's partially built or whatever, do we foot the insurance bill, or how does that work for liability?
Both. We'll have our own liability, and also the general contractor will have their own liability. In essence, we do not want to have people on site unless they've been invited and unless they're given a tour. This is not going to be a place where you can just go and visit.
Right.
Given some of the dangers that might be found on a site such as that. So there'll be site security and other pieces that go along with that to keep people out.
Okay, great.
That was actually going to be my next question. But when you say both will hold the liability, what is it, like 50-50?
No, we always will hold our own liability insurance.
Okay.
Regardless of what's happening, just to make sure that we're covered for everything on our end. The general contractor will carry their own liability insurance to make sure that they're covered. We really shouldn't have anybody on site unless they're invited in as a visitor.
Okay. But say you invite me in as a visitor, and an anvil falls on my head.
You're gone.
We'll call you Wile E. Coyote.
These are my questions, Chris.
I think we're covered in two ways.
Okay. All right.
We will definitely make sure that we check with our insurer on that.
Okay. But as far as this policy goes, we don't need to have a paragraph in here for liability.
No.
Or for me.
For an anvil on a head?
Because I'll be honest with you, I'm going to have a hard time staying out. Okay.
Okay. We've completed board discussion. Let's have a vote.
Kate Bricks?
Yes?
Jenny Butler?
Yes.
Pete Hensler?
Aye.
Marge Gavoni?
Yes.
Scott McLean?
Yay.
Jessica Bridges?
Yes.
Mike McClellan?
Yes.
Kate Levier?
Yes.
Char Jewell?
Yes.
Thank you. May I have a motion, please?
I move,
Go ahead.
oh, sorry, I was on a roll. I move to approve the first reading of policy FF, naming schools.
Seconded.
Thank you. Any public comment? Before we get into board discussion, this is a new policy and another exciting one for new construction for this building. But also kind of defines for any other facilities that we might have in school buildings. It kind of gives parameters for that. Any board comment? Seeing none? Let's have a vote.
Kate Bricks?
Yes?
Jenny Butler?
Yes.
Pete Hensler?
Aye.
Marge Gavoni?
Yes.
Scott McLean?
Yay.
Jessica Bridges?
Yes.
Mike McClellan?
Yes.
Kate Levier?
Yes.
Char Jewel?
Yes. Thank you very much. May I have a motion?
I move to approve the first reading of policy DJR, purchase regulations.
Second.
Thank you. Public comment. Before we get to board comment, we currently have on the books bidding and purchasing requirements policy, DJ. This little beauty, this regulation, is a beaut, and it's 14 pages, and it's another one that was crafted, I don't know whether Bill did this? Did Bill do this?
This was Aga Dixon, who had a chance to work with the board on the transportation facility. This was recommended to districts. It's federal procurement policy. All districts are recommended to take a look at this because with the volume of federal funds that are coming into districts, to make sure that we're following all those different items. It was also a recommendation out of the audit that we update our procurement policy because it had been a few years since it had been done. So it satisfies everything that we need to do as far as procedures for things that we're purchasing with federal funds. A great example, if we purchase anything over $5,000 and don't keep it for 5 years, and we sell the item, we actually have to take the proceeds and return all the money back to the federal government. It's a good reminder of where these things are coming from. But again, this will get us up to speed. Policy DJ, the board worked on, I think, in 2019, which is our current purchasing policy.
Very good. Good date. So again, anyone want to contest an attorney?
Yes.
Okay.
Page 6, D. Can somebody just explain this to me? I'm a little lost on this one.
It's a state thing. Probably has to be there.
That's exactly what I'm thinking, but if we're looking for goods and services, and we see goods and services that are being supplied at a premium cost with, maybe a corporation, a big conglomerate corporation, like Home Depot or whatever. But then there is April's Hardware right down the store, right down the street. Do we have to buy from April's Hardware because she's a female? I don't understand this.
No, it's to include when they're a potential source. If I'm reading here D1, D2, are we contracting with small minority businesses, women business enterprises, and labor surplus area firms? Is that the section I'm looking? I just make sure I'm looking at the same section.
Yeah. Yes.
So no, to the extent that you're putting out solicitation lists, you need to make sure that you're including all applicable businesses on that.
Okay. No problem with that. I didn't understand, so thank you for clarifying.
Anyone else? All those in favor?
Kate Bricks?
Yes.
Jenny Butler?
Yes.
Pete Hensler?
Aye.
Marge Gavoni?
Yes.
Scott McLean?
Yes.
Jessica Bridges?
Yes.
Mike McClellan?
Yes.
Kate Levier?
Yes.
Char Jewel?
Yes.
Thank you very much. Item 10, report of the secretary. Motion, please.
I move to approve the minutes of the December 14th, 2021 meeting.
Second.
Any public comment or discussion? All those in favor?
Kate Bricks?
Yes.
Jenny Butler?
Yes.
Pete Hensler?
Aye.
Marge Gavoni?
Yes.
Scott McLean?
Yay.
Jessica Bridges?
Yes.
Mike McClellan?
Yes.
Kate Levier?
Yes.
Char Jewel?
Yes.
Thank you. May I have another motion, please?
I move to approve the minutes of the December 15th, 2021 meeting. Second.
Public comment or discussion?
Yes.
You know what? Sure.
It's just, there's a typo on the second page.
Oh.
There's an unfinished bullet point here. I don't know if it's an extra or if it's just not finished.
I'm guessing it's probably a task that Christine assigned to me that I never finished. You can throw me into the
Could you, the second page,
Second page, 1, 2, the third bullet down.
what section, about what, okay. Oh. look,
Section
I'm close.
5.
It's a great, I will look into that.
Says one member of the public, and that's it.
I tend to start each sentence with that, so I will.
Well, and it makes sense. I'm assuming that it can just be erased, but.
We'll have to
never know.
double check that part of the video, just to make sure. Okay. Thank you.
Sir.
Thank you. I was not present at this meeting. However, you actually have the correct vote counts on everything. I was absent.
I have the correct vote counts?
You have the correct vote counts on everything, but you have me marked as present for this meeting.
Thank you, Coach. Aside from those technicalities, I want to give a shout out to Ms. Frost-Burtonay. This year is the first year in probably the history of this district that we have had comprehensive minutes. And it's a skill that she possesses that few can top. So aside from the typos, I sincerely thank you for capturing our conversations, our questions, and having, I think for me, it's very helpful to have comprehensive minutes. And in the future, if there's questions from the public, we can certainly send them to our minutes, which are always located on our website, in addition to our videos. So I know I'm belaboring at the point, and I'm a little bit gushing, but you deserve to be gushed over, so thank you.
Thank you. I might not be able to capture that in minutes.
I want it word for word.
I'll piggyback on that because I wasn't at the meeting, but I just read through all of this earlier today. I feel like I was there.
You were, according to them.
All right, are we ready to vote?
Kate Bricks?
Thank you.
Thank you.
Kate Bricks?
What? Oh, thank you, yes. Thank you.
Jenny Butler?
Yes.
Pete Hensler?
Did you have something?
Aye.
Oh, didn't we have a motion on it?
Yeah, we did. Recommended parliamentarian for something of that nature? Punctuation and.
Yeah, for that one, no, but for his,
For
yes.
his, yeah.
For the dot.
But mine might be something.
Yours is the unfinished
Oh, yours
sentence,
is
right?
numbers.
We don't know. It could be something
Could
missing.
be something substantial.
It could be
Well,
something
seeing as we don't know
substantive.
what it is, I think we probably should make a motion to table this till the next meeting when we have
All right.
the
Is
appropriate.
that agreeable to everybody?
So this is an amendment to the motion. The amendment is to table this until the next meeting.
I second the motion to table.
All those in favor?
Oh, all those in
Yes.
favor?
Got to do the
I
roll.
just want to make sure we don't, and then are we voting on the,
Amendment first.
perfect. Kate Bricks?
Yes.
Jenny Butler?
Yes.
Pete Hensler?
Aye.
Marge Gavoni?
Yes.
Scott McLean?
Yay.
Jessica Bridges?
Yes.
Mike McClellan?
Yes.
Kate Levier?
Yes.
Char Jewel?
Yes.
Now we vote on the motion and we don't approve. The motion has to die.
So we vote no.
We vote no.
Thank you. Would you
Are we all
please phrase it?
abstain? No, the motion as amended is to not approve, where are we, here we, is basically to table the minutes of December 15th, 2021 meeting to the next regularly scheduled meeting.
Isn't that what we just did?
Yeah. That's right, I'm sorry, I'll read this one. We're going to approve the minutes of December 14th, 2021 meeting.
The 15th.
Motion. But we're not going to approve it.
No. I know, we already approved the 14th.
I'm sorry,
We're
the
doing
15th. I'm on the wrong line even. The
So wouldn't
15th.
that be withdrawn?
No, we're just not going to approve it.
So you're going to vote no?
We're going to vote no, or abstain.
This is exactly why I'm not parliamentarian. All right. May I have a vote, please?
Kate Bricks?
Yes.
No.
No.
Jenny Butler?
No.
Don't influence her vote.
Pete Hensler?
Nay.
Marge Gavoni?
No.
Scott McLean.
Nay.
Jessica Bridges.
No.
Mike McClellan.
No.
Kate Levier.
No.
Char Jewel.
No.
Okay, so that'll be in the next
Did we get
agenda.
through that?
I think
Yes.
so.
All right. Jeepers. Let's go to item 11, committee reports. Does anyone have anything to report out on?
I do.
All right.
The curriculum committee will be meeting next Thursday at 4 o'clock, and it'll be done via Zoom. The agenda is in the process, using the previous blueprint for process. We were looking at some math and iReady material. We're going to do some update. I've been talking with Christine Hessler about this, and we'll be meeting every other month for the rest of the school year with reporting back to the board about what we talk about.
Perfect. Thank you.
Okay, the vocational school, we're hoping, I hope we have a meeting coming up. I think our last two have been canceled due to conflicts because of the individuals who have to be there, which usually is the superintendent, principals, guidance counselors, et cetera, from the sending schools. So there's been a lot of conflicts, and they haven't been able to pull it off. So hopefully this month will come to fruition.
Great. Al, do you have anything by any chance?
Just real quick, in 2 weeks, there will be the Wyndham Middle School's performance of Frozen Junior, so be sure to check that out.
Perfect.
The One Act, they are going to do a show. There's no information from the Maine Principals Association about whether they're actually going to do it, but there will be a show of sorts, regardless of what it actually is.
Perfect. Thanks, Al. Construction, facilities, anything?
Facilities has not met, and the next middle school construction meeting is going to be on January 20th.
Excellent. Thank you. Pete, finance?
He shakes his head no.
He says no. I can't see you. All right. I do, because the camera's right there. All right. Policy will be meeting, I think it's
Monday.
Is that the 10th?
Yeah.
Oh my gosh, I thought I had a week to go. On the 10th. So I have nothing to report out on that. I think we've covered it. We're going to move into item 13, executive session.
I move to enter into executive session to discuss RSU 14 contract negotiations with the RSU 14 Board of Directors pursuant to 1 MRSA subsection 4056D and not return to regular meeting.
Second.
Thank you. All those in favor?
Kate Bricks.
Yes?
Jenny Butler.
Yes?
Pete Hensler.
Aye.
Marge Gavoni.
Yes.
Scott McLean.
Yay.
Jessica Bridges.
Yes.
Mike McClellan.
Yes.
Kate Levier.
Yes.
Char Jewel.
Yes.
Thank you, everybody.